I've been wrestling alligators. Good day, my friends. I hope this finds you well. If not, let's get well. This is a good year to get well on, right? Hey, Marco, what's that little orange blob up in the last video? That's my grandmother. She likes to come visit me. No. Someone bought me these beautiful bells, and so I guess it kind of caught up into the frame. I like to keep it on my computer. That way I don't have to look at just a computer. I look at some pretty bells. I was a good friend of Sarna from Sarna Bells from India, importer, exporter of bells. And he opened up a gourmet Indian restaurant. We had Ringling Brothers had this huge, I don't know how many stories hotel downtown Sarasota, Florida. And he took the whole bottom, made a replica of the Taj Mahal right in the middle. It's amazing. Glass, you could watch the cooks. They had the tandoori pots, clay pots and stuff, and it was just gourmet. I never had food like that. And I just was coming off all raw. And you talk about painful. It was like I had past life experiences in India because I couldn't stop eating the Indian food, but my body was just hitting me, pain, ache, everything. I thought I was going to die, but at the same time, it was like, what is this? Look at this. Acid relief tea, it's in, my friends. This, excellent for any acidosis of the gut, ulcerations, arthritises. I'm excited. I'm getting ready to get on it myself. I want to see how it feels. Excellent tea. Kind of already in a mailer. This thing is really thick, but we don't want no plastic, none of that crap. And we got this one. We also got it in glycerin for animals and kids for removing kidney stones, gallstones, bladder stones, that sort of thing. Yep. This is going to be the weekend. This is Friday. And I know some of you are suffering, and some of you have made some poor decisions. Like that lady that had 26 lymph nodes removed out of the neck. You cannot rely on your medical professional to give you an honest answer, truth, or anything related to that. Their focus is diseases, and if we can remove as many lymph nodes as we can, all right, they're swollen. Why would they be swollen? Why would your septic tanks be full if you don't have an obstruction somewhere? But in their thinking, the body reabsorbs its waste. And some lady wrote in, I don't know where that question is, about how the body deals with acids in the lymph system. Well, number one, all your waste go through the lymph node system. Vital that all things go through the septic tanks. Common sense. And when you always think about bacteria breaking down tissue, remember in the lymph nodes that you have other cells, macrophages, that break down damaged cells. So damaged cells in your body are taken, if the pathway's open, are taken to the lymph nodes where you have macrophage on it. Phagocytosis. In other words, it breaks down these cells. Bacteria in the lymph nodes are essential, but they're not there for the cells. They're there, or the proteins. They're there for the acids, the metals. And so again, you're creating about 3 to 4 pH acid waste when you have activity, no matter what activity it is. And those, whether it's metabolism, it doesn't matter, even respiration, all wastes and byproducts are acids. Sorry, I mean, that's the chemistry industry. And this is true in manufacturing. It's true in your car exhausts. These are acids. In goes the alkalis, out goes the acids. That is as simple as it is. And you can argue fine points. I don't care. I don't live in that world. It's not a good world to live in. Simplicity is a better world, and then you'll get yourself well. You start getting lost in complexities. And she was asking about bicarbonate neutralizing acids in the body, and I've talked about this extensively. Bicarbonate is there to neutralize hydrochloric acid because you've got a stomach acid to break apart proteins, and the more protein you eat, the more you invoke hydrochloric acid, which is a 1.8, and some chemists claim that hydrochloric acid is a pH of 0. So somewhere between 0 and 1.8, I was taught in chemistry 1.8, but who knows? That's chemistry, the world of maybes. It's like physiology. You know, we say it's in the book, this is the way the lymph does, it dumps its waste back in the venous system. Does it really? Step back and think about that. And number two, think about you don't dump lipids in the blood. There are some minor lipids in the blood, absolutely. It helps the blood buffer of proteins, but you're not talking about a lot. You would never make blood a lipid fluid. You'd be waiting to get oxygenated blood to the brain. That's why your lymphatic system moves with more pressure from interstitial areas of pressure, but also muscle pressure. It's smooth muscle, so it's more like peristaltic movement. And when you ask me about how does lymph move through the body when pressure is in the blood, and so you're looking at more interstitial but more muscle. If you ever break your arm or you're ever sedentary for a while, you can't hardly move. You can't hardly move for a while and because you get real stiff. And it just shows you the reality of muscle involvement in lymph movement. And when you're not moving, you get more sedentary, you get more stiff and sore, especially the more acidically you're eating and the more backed up your lymphatic system is. I mean, it's all right there in front of everybody. But the criteria for looking at that changes. With you guys, you understand that you have two sides of chemistry. You have a bunch of cells that comprise the human body, no matter where you're at in the human body, and you have two fluids that take care of the cells. And each fluid represents each side of chemistry. I don't know how more simple you can get. Simple that elementary children can understand it. Yet in the medical world, full of theories, the complexities they've got themselves into, ridiculous thoughts of thinking. Even a lot of these chemists, and we've talked about that before. Some of the chemists are way out there in their lack of understanding of the simplicity of this. Take a look at metabolism, respiration. Take a look at all the activities of the body and what are the byproducts of this activity in chemistry. And you'll find acids sit on the top crown of that. But that's like I said, that's in industry, that's in your car, that's everywhere you go. Combustion, oxidation, all these things are an alkaline experience creating acids. Right? And you can see this. This is the other thing you can see. Understanding the bicarbonate doesn't neutralize a high-protein meal. Take a look at people that eat high protein. What do you see? All right? You see petechia, bruising easy. You see varicose veins. You see spider veins. You see aneurysms. You see hernias. You see hemorrhoids. You see prolapsing of tissue, wrinkling of skin, all these things like this. Take a look at Eskimos, or those up there that are hunters and, trappers and things, and they eat a high-protein diet. Take a look at their teeth. What you see is not bicarbonate neutralizing that diet. What you see is your blood pulling calcium, the electrolyte, the electron side of chemistry in your body, pulling it to neutralize the proton-rich proteins. That's what you see. You can have theories out the butt all you want, but that's not what you witness, what you see in reality. And these are not diseases. Aneurysm, all these things, these are not diseases. They're a byproduct of chemistry. The consumption of wrong chemistry. It was kind of disheartening to see that Kennedy came out with this new reverse pyramid where high protein diets and things like this. But take a look at him. He can't fix his speech. He's wrinkled up. And it's like, hey, man, You guys are no consideration of the species of the Homo sapien, no consideration of truth whatsoever. I will admit fruits and vegetables are up there on the top side with protein. Okay, that's good. But they put dairy up there. Really? What animal drinks milk after they're weaned? And how quick does a mama try to wean the baby off? If you ever had horses or cows, take a look at that. Up to a certain point, then you learn how to get your nutrition from whatever food source your body is designed to eat. And when you can't do mother's milk, you try to get on that food source a little earlier. Thank God the Homo sapien can juice or some way break down maybe the fruit cellulose. But of all foods, even for infants, the fruit is by far the simplest food to break down for all species. But bicarbonate doesn't neutralize all these acids, and bicarbonate doesn't convert phosphorus to a calcium or any acid metal into an alkaline metal. It doesn't convert nitrogen foods into carbon foods. That's stupid. And yet medical doctors claim that bicarbonate neutralizes everything. It doesn't matter what you eat, you eat all the protein you want. Well, what do you see? What do you see in bodybuilding? We've talked about this before in other videos. Bodybuilders, and I've worked with Mr. Olympia. We got a ton of great bodybuilders. We know exactly what you experience. If you ever seen it, where is that picture? I probably have it somewhere here. I'll get it out someday. What a blown rectum looks like. The weightlifters. And you pump all these proteins, and what do you lose? You lose calcium. You lose connective tissue that holds things together. So your muscles prolapse. Your rectal prolapses. Those are not fun stuff. That's what you see. Theory can be whatever you want to make it to be. Good. Okay. But in reality, in real time, what do you see when the people want these types of diets? Look at the teeth difference between islanders raised on fruit and Alaskan people raised on high proteins. Take a look at the teeth difference. Why? Not the cold air that causes the problem. So, you just really got to take a look at these things and observe. Science is an observed study. You start interjecting theories and stuff like that. It's like 60 Minutes did a big study on a show on double-blind studies. And I was doing a radio show at that time. I had a radio show down here for about 3 years. And then I did a year in Sarasota radio show with the Native American. That was fun. I had a big radio station out of New York City call me and said, how'd you like to do a radio show up here? And I'm going, how? And they said, well, you can do it down there and we'll broadcast it up there. And I said, well, how'd you hear about me? She said, because when you started doing your show, your TV station went kaboom. The people are starved for truth. And people need help. And I would love to be able to get to people before they have 26 friggin' lymph nodes removed out of their neck. And these are young moms and mothers with children and things like this. And it's like, so sometimes you see me get a little over the top. That's because at my age, I've had it with these people. There's a certain point where the illusion has to go away and truth start to appear. And that's what's happening a lot, and you're seeing that. And some people can't take it. A lot of people can't take truth. They're so brainwashed and locked into the lies and the propaganda that bring on truth, and they just fight and struggle with it. Really? Good luck. You'll be spinning around down on these lower levels for a long time then. Oh, well. But and we don't have a complete understanding of the lymphatic system in terms of how it gets to the kidneys. Remember, all the same books that claim that you dump your waste back into your blood claim there's no lymphatic system in the brain. And then all the theories that physiology is full of. And yet it teaches it as if it's factual. And this is what I can't stand, is when you teach things that are theories and you make them sound factual, and then your students start picking these things up, and then everybody gets super brainwashed to truth. You got to start talking about what you witness. when you start these type of things, like diets and stuff? What do you see on these type of things? Proof's in the pudding. I know Jessica wanted me to tell you about this our new tissue repair salve. She was making carrots and stuff, on a grater. Wham! Took a big, that was her thumb, took a big slice right out of the side of her thumb. This was only like 3 days ago. And I mean, she's got pictures, so I'll throw them up for you to show you. She's been putting the tissue salve on it, and I just looked at it and you can't hardly tell it. It's only been 3 days or so. It's like, damn! Yeah, she's going, holy crap! That's pretty cool, That's why. A good salve and the good botanicals. Man, you can do so many great things to heal your body with them. It's so exciting to see stuff like that, This is May. May West? No. This is May. I'll never forget old May West. Is that a banana in your pocket, or are you just glad to see me? 43 years young, 5'6". Hint of a pituitary, probably. 180 pounds, though, at 5'6". So we know that the adrenals are involved, of course. Now, whether the adrenals, the thyroid, are kicked down by the pituitary, or do you have genetics in those tissues as well, that's where iridology comes in and says, well, this is what's going on there. Various myself. Love you, Dr. Morse. I've been following you for the past 15 years. Let me give you a hug, mate. Love you, honey. Thanks. I don't know how you can put it up with me, though. I've been struggling for about 6 years. Don't have COVID vax. However, I've had COVID a few times. So you know that when you have cold and flu, I don't care what you call it and what level it is at, your lymph system is a problem. And that's what you have to look at. And you will have these symptoms whether it's wintertime or not, especially if you're on a high fruit diet. You keep pulling up stuff and pulling up stuff. And that's, we've had some people just on fruits, solid, and they just keep pulling up stuff, pulling up deep stuff in tissues. And when you look at the lymphatic system in the body, which this is a great representation of it, right? You got a lot of spaces that are compacted with congestion and mucus and stuff like that, and sinuses and all this. The head area is the hardest to drain, and I think one of the big reasons why is we don't consider the relationship between the transverse bowels and the sinuses. But there's a big one. I said oftentimes people will have a bowel movement and their nose will start running. You'll see that connection. When you watch and observe your body and how it responds to different foods and stuff, you start to see all this taking place. Besides, for being overweight, my body feels heavy besides my brain. Yeah, see, and that's, when you see a pituitary down, the question is, what brings the functionability of an organ or a gland or cells? What affects the functionability of tissues, of cells? Well, you only have two major fluids that directly affect the cells. Outside of trauma, you've got blood and you've got lymph. You've got kitchen, you've got sewer system. And this is where the sewer system is where most people are having serious problems, not the blood. However, a lot of people have had a lot of problems because of the high protein diets. Get away from that and take a look. Look at dairy products, the most clogging, mucus-forming products. People praise milk, then how come it's the most mucosive, responsive foods on the planet? It's the most mucus-forming foods on the planet. And when you're causing mucus from your mucosa, your body doesn't want that, whatever it is. Even your habaneros and your cayennes, your body are not designed for those hot things. And that's why you see a lot of mucus produced when you consume them. Well, mucus in, mucus has got to come out, or you have pressure. The other side of this is the more acidic, or the more that this builds up, the more acidic you become, edema adds to the case. Remember, I told you this guy was giving a lecture in this big church down in Fort Myers, or off on the beach there. And full of people, big church. This guy comes running in. I watched him come in, the big, beautiful doors that opened up, come running up to me basically and said, "Are you Dr. Morse, Dr. Morse?" And I'm going, "Yeah." He goes, "If you," and right in front of the whole congregation, he says, "If you can't help me, I'm going to kill myself." I'm going, "Well, what's wrong, Mo?" And he goes, "Pressure. Pressure. I can't handle it. Pressure. They can't do anything for me. Pressure." And that's where you can get serious, serious pressure. Well, I helped him. I did a picture of his eyes and took a look at him and said, "Oh, whoa. I hadn't seen a lymphatic system that chronic in anybody in a long, long time. That's been about 30 years ago. But still, and it was like, holy crap. And I've seen a lot of that. Matter of fact, I had a famous magician's wife. She had the same thing, a lot of pressure. She also had sulfur problems. But as we started opening that up, she'd get a lot of congestion running out, and then her brain felt like it went numb for a while. And then it came back. And that's how that pressure and pressing on these areas like that. And the nervous systems. I mean, it gets scary. And yet we get in our society pushing that. Feed your kids milk. Really? What animal drinks milk after they're weaned? And there's a good reason. And yet all animals don't pasteurize their milk before they feed it to their kids. Stupid. You're going to destroy and change your milk from an alkaline source to an acidic source by pasteurization. And now you've got something your body just can't stand. I mean, it's sick. I've said this before. If you've got tumors, just drink a glass of milk and watch your tumor grow. Not good. So it would make sense, honey, that you would have that in the head area. Because when you look at what affects the functionability of cells, well, if you don't get blood to them, yeah, but that's gonna destroy the tissue. So you're always going to go to the other side of the coin, to the lymphatic system. I know it's the lymphatic system that either suppresses or hyperstimulates organs and glands. In other words, you're diagnosed with a hyper or a hypo condition of whatever. Acids are stimulants. That's why people suck down protein diets, and those that suck it down, if they don't get it, they need more. Now, you're not burning proteins for energy, bro. How come you need more? Because you're used to living on stimulants. Protein is a major stimulant. That's why they always said, if you want to have good sex, have a piece of meat before. Also, hormone. I said brain fog plus feels like brain inflammation. Yeah, and that worries me because, again, remember, the word inflammation is not a disease. It's your body's immune response. And the immune response has interleukins, histamines. Why would you want to bring more blood into an area? What side of chemistry is blood on? That alone in chemistry tells you that the problem is acidosis. That alone, right? In understanding the two sides of chemistry. But I also link edema, bringing in water in these areas to help neutralize. Also cholesterol or yanking of calcium to help neutralize that. Anything that the body can find to help neutralize acids, because acids are corrosive. They break down cells as they break down anything. And so you just understand that when the body gets acidic, you're going to have the word inflammation or an inflammatory response to this. Body trying to protect itself. But then in that case, you can get serious edema. And that then becomes life-threatening. So it's just, but you're supposed to be fixing these things. Also hormonal issues, low progesterone. And see, progesterone is the alkaline side of chemistry, so that can leave a woman estrogen dominant, But if you take a look at these acids, and I was thinking about this the other day, estrogen, I've tasted estrogen. Estrogen is bitter like testosterone. It's bitter, but it don't burn you. Because if it did, producing it, you would be concerned about losing your enamel on your teeth. God isn't that stupid. But when you start getting down into the 4s and the 3s on the acid side, that's low cortisol but high TSH. And TSH is thyroid stimulating hormone. And that means either the thyroid is struggling or you have a little hyperactiveness to that side of the pituitary, because you're showing hypopituitarism at 5-6. I was looking at Body Bazaar. If you have a chance to watch that show, it's amazing. They can't help half these people, but we could. This poor teenager, she's up at 7 foot something, and she's very misshaped, but you can tell brain. You can tell pituitary. They don't know how to help her. I have low CRP and normal TSH antibodies. Yeah, because that's just your thyroid struggling to get along, or you're overproducing it. It's my feeling that your body's trying to get your thyroid to move better, but you're fighting overweight. So again, that could be metabolism, the rate of your metabolism, and also your adrenals. You can tell both of these are talking about the two glands that are responsible for obesity, thyroid and adrenals. Your rate of oxidation and metabolism, and your sugar metabolisms. Both of those directly affect your weight problems, but also your emotional problems and things like that, right? Depression from the thyroid, and anxieties and panic attacks from the adrenals. I know the head area is one of the hardest places to detox. She's right. You're right, man. You're right. But again, remember, that's why I go into the bowels. There's a reason why you see these detox the way they're designed. Check out our site with that, Getting Healthy, and look at that. But that's why. Because you've got to start cleaning up the gut a little bit because of the relationship. The embryonic relationship. Remember that embryonic tail? When the egg bulks into the embryo looking, the tadpole looking, that's that embryonic trunk, they call it. That's your GI tract. And all your organs and glands spring out of that. So there's that interrelationship between all things in the body, electrically, lymphatically, and blood-wise. It's ever so connected. Look at the spine. Again, that part of that embryonic trunk. You got all your nerve, your blood, and your lymph factors coming off of that. But I can't seem to get it right. Now, another thing you can do, honey, is do your neurolymphatics down your spine a lot. If you got someone to help you do your neurolymphatic points down your back, highly recommend that. You can also use hot and cold, no question with that. So it's a combination of several things to help yourself with that. Make sure those kidneys are filtering. You don't get your kidneys filtering, I can just tell you guys from all of our experiences now, we know you don't get well. So again, with the low adrenal glands, kind of hard to get the kidneys to filter, so you're working on these tissues. It becomes simple when you start looking at the body only has certain organs and glands to it, and that's all designed to keep it working as a machine. Keep you upright, walking, talking, all that sort of thing. It's just a car, it's just a vehicle, but you have to have certain components. Like it's nice to have a motor. It's like but I've worked with 2 of your graduates, tried fruit diet and a ton of herbal tinctures constantly, and things just aren't bulging. Well, I don't know what to say about it other than think about the things that I'm talking about. Send me a picture of your eyes if you want to, May. We'll take a look at those. But as far as what under my care, that's what we'd be going after. We'd be going after your gut. We'd be going after your endocrinology. We'd be going after your kidney filtrations, that sort of thing. And all my students should be going after the same thing. Because if you learn anything from my school, it better be the understanding of how the body works simplistically and how you get these things going. Now, the new class is going to be up one of these times soon. I'm just waiting for the producer to get all that put together. But I've got clinical herbology done. I've got the exams done. And so it's just waiting on him, and then we'll have it up for you. And that's a little, I'll get into clinical herbology, how you use herbs in a clinical setting, which we'll be going over this and over this. But again, it could be a gut. And again, on the other side of this is think of the spiritual side of this too, sweetheart. Go into use of contemplation, release, let go from past lives, let go, let go, let go. It doesn't matter. Nothing matters but the moment. The past is gone, dead, but our moment is always built upon the past, and it just, all these past experiences can register in the memory patterns of cells because they're in the memory patterns of the astral body, the mental bodies. And that's why the whole concept of meditation or contemplation, where you're letting it go, giving it over to spirit or the prana, life force act, whatever you want to call that. You're giving it away. You're letting it go. Get it away from yourself. Mm-hmm. I have good circulation. My kidneys and liver are healthy. Are they filtering? My body is strong, and one looking at me would not think I have health problems. That's good. That's good. But you're not draining here. And again, here's another thing to consider, the condition of your lymph nodes. Have your lymph nodes been backed up since birth? And if they are, could they be, somewhat heavily involved? That's what your iris will show. Help you look at your lymphatic system and how involved are you? The gut, how involved is the gut in this? And again, I say those with sulfur problems have a little extra problem there. Health problems. Not sure why things aren't moving. Is the extra weight holding back the flow of things maybe? Could be, but I would think, simply put, that your lymphatic system would be. Again, the lymph nodes, you don't know what condition they are. Remember, things have to pass through the lymph nodes. That's a whole important issue of why the lymph nodes are there. They are your primary septic tanks. And you even have them for the kidneys, the bladder. Everything has to pass there because you cannot pass 3 to 4 pH acids through your kidneys and be a smile on your face. That's not going to happen. And you'll burn and start getting stones in your bladder and everything else. And it's like, no. That's why it's so important to have bacteria. And they can put you on these lifetime antibiotics or a year-long antibiotics. These guys are el nutso. What happened to their understanding and physiology about the role of bacteria? But they're lost in the Pasteur idiocy and the rife idiocy of the microorganisms and things like that. The outside world is coming to attack you. Couldn't be anything you're eating. Couldn't be your terrain. Couldn't be your sewer system. Sabrina's 63 years young. Uh-oh. Honey, 5'2". Immediately, she's only 138 still for 5'2". My sister, believe it or not, was 5'1". My family weren't short people. Thinking postman, that's what we were thinking, because she didn't look like the rest of us. I was thinking, maybe, is that postman good looking? But 5'2". So immediately you're going to go right to that pituitary. There's no questionano about it. And remember, the pituitary controls all the other endos. So you can have a host of problems just from this problem. But also, again, looking at the connection, the embryonic connection, you're always going to go to your colon too. I don't see how you can have a sinus and head problem without having a transverse bowel problem. And they disconnect, and you can see that in iridology all the time. That's what's beautiful about what you guys are learning. Fun stuff. And you get to learn what causes these things. Yeah, I'm working it. Yeah, working it is working it. But no, the rest of the world isn't working it. You guys are working it. And it's better to work it and understand what's going on than to sit there and have a medical doctor remove 26 lymph nodes out of you because you didn't understand truth and didn't understand how to say no removal of lymph nodes, or you're going to get sued, and write that in writing. Diverticulitis. There we go. There's your connection right there. Diverticulitis without pouches. Diverticulitis without diverticulum? It doesn't matter. I mean, it's just saying that, what is your problem? Where is it? Interstitially in the wall of your small and large intestines. Well, what could make up the wall of your tube going through you? A bunch of cells and tube fluids. Oh, it's a garden hose, right? moves peristatically, moves your stuff through. You have enzymatic action all the way through, and absorption, the release of energy, all the kind of good stuff down through there. So what could affect that? Where could that inflammation be? Now, of course, if you're eating a high-protein diet, the acid-ash foods are going to burn back to the wall. There's no question. The mucosa is going to get affected big time. And if you're doing grain products, you're going to get the mucoid plaque. However, when you're getting serious, what we call inflammation, remember, not a disease, we're talking about immune responses, in the gut wall or anywhere, what's the problem? Lymphatic stagnation. I like to call it lymphatic constipation because you're constipated lymphatically within the walls of the intestinal tract. And it'll ulcerate, it'll burn through, it'll polyp, it'll do all kinds of things. Just depends how weak your connective tissue is, blah, 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 blah. But to have diverticulitis without diverticulum, interesting. Whatever the diagnosis, these are medical doctors, maybe smoking something before they come to work. I don't know. Holy crap. I was told to have colorectal surgery to remove my entire large colon due to the bleeding. I'm scheduled for surgery in January. This is January 8th, 9th. Oh my God. I have been managing since May of this year, since my last episodes. What advice would you have for me? Don't remove it. We have a bleeding formula that'll help you check internal bleeding like that, but you're extremely acidic, so where are you going? You're going to kidneys. You immediately want to hit the kidneys with at least 2 kidney formulas. I would do 1 lymphatic formula. If you're using our new line, you could get away with just 2 kidney formulas for about 2 weeks or so, and then maybe add a lymphatic formula. Majorly, you want to start drinking this on a regular basis. I mean, I've been doing the stomach tea to see how it is, and I've been drinking it off and on all day long. Yeah, you want to get some of this as soon as possible and start getting this. Is all full of the antacids. They also check internal bleeding, but we have a formula I designed just for internal bleeding like this. And get this to stop bleeding at the same time. You're going after the system that's down because removing the colon doesn't do anything but make your life a living hell. I mean, a permanent bed user. These guys don't know how to stop any of this. They don't know how to back it up. So they just cut it all out. And I can tell you, not a smart thing to do. And I hope this gets to you, Marco. I hope this gets to her fast enough. Because she's scheduled in January. I would at least attempt, I don't know how advanced you are in that level, but I would attempt these things that I'm telling you ASAP, overnight this stuff to you, and get on it as soon as possible. And if you got a local health food store, run down there and see if they have any slippery elm, marshmallow, anything like that, mullein. A lot of these health food stores went nuts, no herbs, no things like this. Candies. Man, I had 300 herbs in my health food store. But, we're commercialized. But that's where I would be going. I'd be going. And, of course, what would be the diet in this case, guys? Fruit only, and I would make it only grapes. I would not head into the... I would not head into anything acidic like pineapples, anything like that, apricots, soothe, pear juice, good ripe peach juice, things like that. You could also do some cucumber juice, cooling, that sort of thing. Absolutely. You want to get down there with things that are easy to digest, anti-inflammatories, antacids, in other words. That's going to be your fruits, your berries, your melons. I wouldn't do berries if you're that sensitive right now. Get our bleeding formula in there. Sometimes you can use herbs to treat. And we have herbs for seizures and spasms and that sort of thing, but we also have herbs for hemostasis to stop bleeding. And at the same time, we're going after that system, and we're not going to put anything else in the body. Would you recommend a protein diet for this lady? I wouldn't doubt if the medical doctors would. Yeah, go ahead and kill her. Oh, my God. So, Marco, we got to get to this case. Hang on 2 seconds. There you go. Sorry about that. But, honey, yeah, you're not going to like having everything removed. You can start working on that immediately with the things that I'm talking about. Get this in here and start drinking it. You could also insert it. You could do an enema and insert it in that way as well. Absolutely. That's why I'm trying to get suppositories, but absolutely. Yep. You can even do that cell regen salve and get it up in there as far as you can. But you're not just going to be involved in the GI tract. When you're that bad in the GI tract, the rest of your lymph system is probably not a good place to be. Here's hyperthyroidism right here. There's a 5'6". She only weighs 101 pounds. And she's 70 years young. You got hyperthyroid at 70. I'm amazed with that, Dolores. Well, again, when you look at what makes things hyper or hypo, you're looking at acidosis. And that doesn't matter where it is and that sort of thing. When you have something hyper, guys, you're not going to take something for it. I wouldn't take herbs for the thyroid if you're hyper. I would go on a detox and leave out maybe the endocrine gland formula and start going after the lymphatic system, the kidneys, the GI tract. Because in theory, you could have a highly inflamed area on your bowel hyperstimulating your thyroid. Because remember, that's the embryonic trunk. So that's why you're always going after your GI tract when you go after it. You're always going after the kidneys. You're always going after the lymphatic system. In most cases, you're always going after your endocrine glands. They control everything. Doesn't that make sense? And then you're always going after your gut. You're always going after the bowels. Now, I also like to go after the nervous system or the liver or whatever. So I always look at 2 other formulas when I'm going after that. I always like to go after the liver, especially in the beginning month. That's your chemical factory. And that's the blood side, of course. And then a lot of these herbs are great for the gallbladder, which is your lymphatic side. Yeah. They say it's my parathyroid and needs to come out. Oh, look at that crap. That's your lymphatic system is all that is, sweetheart. Since 2021, the day after a vaccine. Oh, that's why. Yeah, look at that. Which I kicked myself. I started shedding my hair. Oh, crap. Fast forward, still shedding. Yeah, that's heavy metals, stuff like that. Traveled up to the brain. I tell you what, these guys, I can get over the top here. I've had to live with this for 50-some years, working with people that have had vaccine injuries and stuff like that, wondering, you dumbasses, what the hell are you doing to the human race? These people are just stupid. And yet they're top of the governments, top of this, top of that. We know everything. You don't know jack doo-doo, medical doctors. Unless you know about how the body works, what we're talking here, you don't know jack doo-doo. Your theories don't work. Your theories are killing people all around the world more than wars. What? You don't kill people to make them healthy. They say it is my parathyroid and needs to come out. Then you'll start losing your bones, your connective tissue, your teeth. No. And the only reason that you would have a parathyroidism vomit is the same system that's affecting the thyroid, which is going to be, let me see, blood or lymph. You only have 2, pick one. Blood is always alkaline. It doesn't hyperstimulate nothing, doesn't break down anything. Thank you. That only leaves 1. That must be tough on medical doctors. I mean, it's only one system that you got to blame for these things. Or you live in the world of diseases. Oh, she's got a disease. Her parathyroids are diseased. Diseased? I'm not much into surgery, thank God. Oh, you're going to pay the price. You don't remove your endocrinology because they control everything. And what happens to the parathyroid is your bones, your connective tissue, your happiness. I can just tell you case after case that I've seen parathyroids removed. Shoulder surgeries and damages can't heal. Surgery can't heal. If you don't utilize calcium, you can't heal well. Connective tissue can't heal well. Bones can't heal well. And if you're that acidic, you're going to lose these tissues anyway. Tell them to go sit in the corner, you'll be back. Right? There's got to be a way to weigh without surgery. Of course there is. Always is, honey. Unless you're so advanced you have necroticized tissues and stuff. Yeah, maybe. But then your body can take that out and rebuild it. I have high calcium levels. Look at that. And the reason you do is you're not utilizing it. See, and that's the problem. You're not utilizing it. And you could be losing it out of bone and connective tissue. You're not utilizing it out of the food you eat. And that's parathyroids. I've said this for years. Not the thyroid and calcitonin. It's the parathyroid and parathormones. I've been looking at this intently for 50 years. Been one of my big babies, understanding the difference between the thyroid and parathyroids, because a lot of physicians consider the parathyroids as worthless. Really. Oh, there's big time levels. I believe is the level, and calcium is in my urine. Yeah, and you can start stoning up a little bit as well. You're not utilizing it. Your parathyroids are probably down, but the only thing that makes them down. And my next question is: do you still have your tonsils? Because, just when you're starting being involved here lymphatically, guess what? You've got 5 tonsils in the mouth. It's also going to be involved. They're your lymph nodes to your mouth and your throat. Unless you're removing some of these lymph nodes. Oh, crap. Remember, the lymph nodes are essential to the drainage of lymph out of these tissues. It's your septic tank to these areas. Essential. Now, they just don't get that and understand them. Well, sweetheart, if you get a hold of them, Debbie, see if you can get a hold of her. Dolores, see if we can't get a hold of her. She's 70 years young. And at that age, she doesn't want to lose her parathyroid glands. Because at that age, she's going to lose her skeletal system and that sort of thing. And that's not good. And it's already showing the high calcium. Why would there be high calcium? Doctors. Sorry, guys. I know a trash can got me. I was fighting with my trash can. Slapped me good. But serious stuff here, guys. William Clayton, a man, United States, 68. Well, I've gotten all these older people. Middle-aged people. 68, he's 5'11", he's 161 pounds. A little skinny, but you know what? I like 160. Bladder cancer. Ooh. Drink the hell out of this. Get it in and drink the hell out of it. Just really get that going through your kidneys and your bladder. Antacid, anti-inflammatory, so to speak, really starts to heal because you've got to move your lymph system. And guess what your lymph system moves through? Your kidneys and bladder. So you have to take a look at his lymph nodes related to the bladder and the kidneys, because that might be where he has his problems. So again, you're going to work on that. We've got the kidney formulas, the lymphatic formulas. You want to work with that? I would definitely work with this tea here, big time. We also have the acid relief in glycerin now. It's coming in capsules. Probably be a couple of weeks before the capsules get in here. And I'm looking forward to the capsules too. I took the, Fix me a rum runner, would you? Some of these people are driving me nuts. Get this. I took the very same chemo treatments for 6 weeks as did that lady you brought up, and deeply regret it after watching your videos. Yeah, they burnt your bladder to hell. I mean, when you're at 1.5 to 2, ask your oncologist, what's the pH of the chemo? I asked this one oncologist, he goes, well, I'm not sure. I said, look it up. He came back with 1.8 or something like that. I'm going, how hot is that, broski? You're putting that in someone's blood. Guess where it ends up? Trying to get out of the body. And which way does it get out? And that just shows you the pathway of acids. The kidneys and bladder. And it burns all the way out. What neutralizes? You yank the calcium right out of your body with chemo. That's why you see aneurysms with chemo. That's why you see the collapsing of arteries and the aorta. Well, you see aneurysms, stuff like this, herniations. And that's with 3 pH acids. Imagine 10 times hotter than 3, which is 2. And then if he was given 1.5 or so, holy crap. This is 500,000 plus hotter than your blood. What? And these guys are getting away with it and not going to jail for it. Not in my world. You'd be behind Great Bar Hotel. Damn, I've had 3 bladder surgeries after 5 months. Oh my God, I feel for you, bro. I do. Get on this acid relief tea. Start soothing, cooling everything down. It'll also help to neutralize this chemotherapy and just start cooling everything down. Let the body heal. We have a tissue regeneration formula. You might want to get on that down the road here a little bit and let the body start rebuilding the tissues of the bladder. Grape diet, period, end of story. Bam! Get on a grape or grape juice diet. My doctor found another small tumor to now it will be a forced surgery. There's a time we have to quit cutting these tumors out and getting your kidneys and bladder to start filtering this out of you, because it's just showing your body is not filtering properly. And that could be a lymph node problem. And that's the one thing you don't want, is him removing any lymph nodes in surgery. Oh, crap. Especially to where you're having the problem. Of course, they can always remove a healthy lymph node out of somewhere else out of your body if you want to go that route. Yeah. I wish I would have seen your videos before taking the chemo treatments. And listen, guys, from the bottom of my heart, this is why you're so important out there, each and every one of you. You're so important because you're listening firsthand what people are going through, the suffering they're going through at the allopathic hands, because allopathy doesn't understand health, doesn't understand why everything's happening, why is there tumors. They don't understand the lymphatic system. Forget what the book says, you don't understand the lymphatic system. The lymphatic system is a sewer system that uses the kidney and the bladder and the skin to eliminate acid waste. And if you're not eliminating, you're accumulating. And that's why tumors, cysts, boils, pimples, styes, a whole gamut of what you see in occlusions or agglomerations. If you have no obstructions to the flow of blood, nerve, or lymph, you're very dynamic. Your body is very dynamic. And as soon as you start developing obstructions, you start developing symptomology. Please tell me how I can rid my bladder of the chemo and restore the cells I most likely killed. Oh yeah, definitely killed them. The cells can't stand 3 pH. Cells can't stand Coca-Cola, 2.5 to 3 pH. That's basically where you find most soft drinks, even Gatorade. So cells don't survive those low pHs like that. No way. And that's why. And they want to give something hotter than Coke. Chemo's at least 10 times hotter than Coca-Cola or Pepsi. Something that hot that destroys cells already, and you're going 10 times hotter? I don't know where their lack of brain power comes from. Maybe they were raised from wealthy parents that, That's why that progressive lady in New York says, owning your own home is white supremacy. Really. one cuckoo. Everybody has the right to own their own home, no matter what color you are. White supremacy to own their own home. Where does this kid raised? From a wealthy family, obviously. It's what it said. This is Bobby Lee. Bobby Lee Musil. Ireland. Meggie from Ireland. I haven't talked to her in a long, long time, and her husband, Sean, who is a naturopath. And she was an RN, really heavily got into this. So I don't know what they're doing now. They have their own farm, and they were going to, really be involved in working with people in Ireland. So I don't know. 52 years young, 5'11", weight fluctuates, lungs, mucus, breathlessness. Okay. So before we read, let's look at lungs and breathlessness. Keep in mind that breathing is a what experience? A neurological experience. What neurological? You have two nervous systems. Which nervous system is involved in breathing? The autonomic or the automatic, right? If you had to consciously breathe with every breath, that'd be, and I've been there. So the autonomic, it's automatic. Now, what feeds the autonomic nervous system? The adrenal glands and the solar plexus. So you're always working on the gut, embryonic connection, and you're always working on your adrenal glands. All right, that brings nerve power to breathing, and we have a formula designed for that to help enhance nerve power, but you want to get your adrenals up. Now, your adrenals are sitting on the kidneys, and so immediately you're going to be looking at that. So the lymphatic system in the lungs can back up and swell the lungs up. You got a lymphatic system everywhere. And once they start backing up, it's either right side, left side, or both, right? And then mucus, of course, that's all from the mucosa. And remember, certain foods are very mucosic responsive. Proteins, mucous membranes do not like proteins. They do not like acid-forming foods. That's obvious. That's why the mucosa exists, is to protect the tissues from acid damage. Acids are corrosive. Just chemistry, simple chemistry. I'm not this brainchild chemist, but I know enough about chemistry to understand the reality of life here in chemistry. Could you please talk about fasting one way into a breatharian lifestyle? Oh. Yeah, I know I was headed there. But keep in mind, when you're getting involved in these levels, I like to go through this process of getting there. And the process of getting there is getting all your endocrine glands healthy and things like this, because one of the things that you see is when you start detoxifying and you start getting up into these higher levels, you're going to start pulling out your genetic weaknesses. Your adrenal glands, for example, are going to go down to your genetic path. And if you have real low adrenal function, and most spiritual people tend to, you could get into some breathlessness just from the lack of proper neurotransmitters, and your adrenals are going down and down. It's not that your diet and everything else is creating it. That just seems the way the reality is in your body. Your weaknesses start coming forth because you've been using stimulants to keep them up going. And a raw diet is it's a non-stimulating diet. It's a dynamic, energetic diet. You're pulling off of stimulants. And when you pull off of stimulants, everybody goes, just like that. Your adrenals can crash. And you're eating everything right. You're eating all raw, you're taking the herbs, and yet your adrenals crash. I had this lady, she worked for this dentist, and she called me with chronic fatigue. All right? So I put her on the herbs, put her on an all-fruit diet and that sort of thing. Well, she kept getting more tired, ended up in bed. She said, I can't hardly move. Her dentist called me. He said, listen, I know, doc, you know what you're doing. He said, but I think she's going to die. I said, no, she's consuming high energetic fruits, and that's all electrical, that's all nutrition, so why would you see that? And again, if you don't understand detoxification, you haven't been through that, as a physician, you wouldn't understand that at all. And sometimes we can't explain it either, it's just that that's what happens and what you see. So I hadn't heard from her in a couple of months because we were so busy, and she just popped into my mind's eye, and I told Megan, I said, man, we got to get a hold of her. I don't know she's still alive. And we got a hold of her, and she said, oh my God, I'm so sorry I didn't call you. She said, I tell you, it wasn't a few days later after we last talked, she said, an energy came into me. She said, I can't even describe it. She said, I had so much energy, I didn't know what to do. She said, I'm so full of energy right now, I don't even know what to do. And I'm going, whew. That sort of thing. And it's like, man. But I've seen this over and over and over again. And you can, like I said, high blood pressure is low blood pressure. You're going to have high blood pressure. You're going to see it go down. Well, wait a minute. Come back. And you're going to go down to your genetic past. And you could end up going really tired and fatigued from that because you're on a non-stimulating diet. You're on a hydrating electrical diet. Things become more dynamic, more electrical, instead of your protein stimulants, your acidic stimulants. And that's just what you see. So heading down that road, you want to go through the process of raw foods, cleaning up the gut and all that, getting into the fruit only. I was headed toward breatharian. That's where I wanted to go. I was an out-of-body traveler. I wanted to go totally off the prana, the life force. I figured that carbon is your carbohydrates, your sugars, your nitrogen are your proteins, your hydrogens, are your lipids. So as you're breathing in these, you're breathing in a higher level of what manifests down lower in foods. So I was thinking, I'm going to start living off that prana, the life force. But like I said, my cells in my body didn't have a hard time handling that level of energy. I couldn't break off the fruit because I was having out of body constantly. I couldn't rest at night. I mean, my body would be there. I'd be out in these worlds and working with masters and beings and all kinds of things, being educated, trained, and just, exploring and all that kind of thing. And come back, my body just couldn't handle it. Even though I wasn't in my body still was a victim of that energetic connection, the silver cord connection. And my body would cramp and ache and stuff like that. And it was rough. It was rough at one level, fun at another one. So, I realized, I had to come down and balance. And then I was poor as I was living in my van. I run out of my savings. And so I had to go find a job and do something. And it's like, dang. And I didn't want to come back into civilization because you do get a little like this when you get into the alone state. You don't want to get back out into where the humans are because the human consciousness, animals, oh, come on, baby. But humans, there's all these levels. Oh, my God. And you're seeing them now on the news. People fighting ICE and all this stuff like that. And you're fighting the laws and you're fighting this and that. And you don't want to have peace and love and stuff like that. You want to have all these killers in our society or something? I don't know. I don't know where people get off at. I really don't. So that's one of the things you have to think about. I have been deeply detoxing on and off, and I figured that. But this time it required a deeper one. Yeah, and see, we had one lady die. She just going deeper. She wouldn't listen. She wouldn't listen to me. She wouldn't listen to Shannon. Deeper. Longer dry fast. It's like, no. Shannon and I both pull our hair out with her. Wouldn't listen. Always ask us, what can I do? And show us pictures. I'm going, break it. No. I am currently into nearing 40 days of mainly apple, black grape, lemon, and honey. And the odd piece or raw ginger to chew on. Yeah, you're getting there, but then keep in mind, I don't know what your eyes look like. Take a look at your eyes and see how much lymphatic issues you have because you're going to be honking into these deep levels. You're going to be pulling into these deeper interstitial levels, but that's in your lungs, that's in your liver, that's in your heart, that's in your brain, and so you're going to be pulling on these. And so a balance, going back and forth, know when to hold them, when to fold them, that sort of thing, and work yourself through that because, or you get into some of these serious things like that. I would also think about taking something from my adrenals. If you have a way to check your blood pressure or go into somewhere where you can put your arm in a cuff or something, but check both sides, see which side's the worst. And then again, if you remember the 3 fingers over the pulse line, you want to do that when you feel like you're just, trying to take a deep breath and can't. Get that pulse up there. So get those 3 fingers on the pulse line, and you feel your pulse starting to beat faster and faster and harder. Then pull off. Don't hold it, or it'll go the other way again. There's a saturation to all these things, energetically and everything else. And so you can do this on the right side. Generally, it's the left side that needs more pulsing. But, your right side might be it too, But that'll help. You'll feel your body take a deep breath then. And then you'll start breathing a little better. So you're working on these sort of things. Work on your neurolymphatic points to help the flow better, and that sort of thing. Make sure your kidneys are filtering. That's all I can say. I had no idea. I was filtering well when I was living on just oranges. I was filtering well. I was just like, but I didn't know that you didn't filter. I'm just a young kid, man. Fresh out of the Air Force and ready to be a fruitarian. And then a breatharian. I wanted to get out. I wanted to get out there. I want to know what God is. I want to know the truth of life. What's behind all this awareness? What's behind my awareness? Who am I? I know I'm not the body. I've been out of it. I'm looking back at my body. Nah, that's not me. And I've got other bodies. I'm behind those. I'm not any of these. What am I? I am not clear of the congestion of lungs and still bringing mucus up. Well, you can get a lot of mucus out of those lungs. A lot. And then, of course, that's going to block breathing a little bit as well. So you got 2 things to think about, and that's also with asthmatic type, all the COPD chain, they call it. You're going to see both things. You're going to see neurological weakness out of the adrenal glands, and you're also going to see congestive issues. And both have to be considered. And this is why I've said this before, when you're working on a quadriplegic, paraplegic, you want to have maybe a suction machine there. Because they don't have the nerve power or the muscle power to cough this up. And that can be life-threatening for them. There's a lot of considerations when you're a healer. And a lot of people at advanced stages that you're trying to pull out of this and get them out of this trouble. So it's just being smart and understanding things. But the body's going to pull up and try to get rid of a lot of mucus, both from the sinuses, from the thyroid, parathyroid, throat area, but also from the lungs. Mainly clear and a little yellow at times. Well, that's not bad. It's when it turns green and brown, and then when you get the black stuff out of the lungs, that's some deep crap, man. And I've gotten black crap out of people's lungs. I've gotten black mucus out of children's lungs. Unbelievable. Unbelievable. The necrotic crap. I am very fungal and live on, frugal. You could be fungal and live on little, so I cannot buy your herbs here in Ireland as I used to when I began the detox journey. Oh, well, see if you can find some wild herbs then in Ireland. I don't know what all you're accessible to, or health food store. Have someone out there, an herbalist, help you find some wild herbs and get on some wild herbs like that. I began taking adrenal glandulars by Swanson and take licorice root powder generally for health. That makes good sense. I wouldn't take the glandulars too long. You might go the other way with them. Just feel that they'll work up to a point, but there's a saturation, in my opinion, with the glandulars. The licorice root's smart, I think. Also make nettle, thyme, oregano, and sage tea with honey. That sounds good. Yeah. I have been asking our Father to bring me into the higher cycles and into non-eating. Feels possible now after this length of fast. Yeah, I don't know what to say about it. For most people, that's very austere. That's way out there for most of our listeners, probably. That you can live off the prana, the life force, both internally and externally, both through the air and internally. Because look at the nitrogen, hydrogen, carbon, and all that of the air, and that's just translated into carbohydrates, lipids, and proteins in foods. And so you can get up there, and there's been a few cases of yogas and stuff like that have been up there, but not a lot. Johnny Love Wisdom was famous for trying to do that. I don't believe he ever got there, but then it's hard to tell where Johnny Love Wisdom ended up. But those are old days. Those are old times. He'd be 100 now probably. But you don't know. It's hard to say. But that's very high levels. And interfacing in a toxic planet, I don't know. I don't know what to say about it. I would never want to try that anymore. I'm not even have the faintest desire. You're opening a door to a lot of potential complications. You would have to live up where there's a lot of greens all the time, fresh air all the time, and do the proper breathing all the time, where you're breathing in air, you're breathing in oxygen, which is really good, clean oxygen all through the body. I wouldn't live up in the higher altitudes. I have been asking, I would love to hear your take on the degree of a shift. Love you always. Love you. Bobby, your brother Bobby. Love you, man. Yeah, I mean, that's out there. I know a lot of you guys think that's way out there, but for the spiritual people, trying to get away from the earthly body, food, bowel movements, urine, all this kind of stuff like that. But then you got to look at that too when you stop processing foods. And it's like, I just don't recommend it. And yet I was trying it, but I don't know, it's rough. That's why I think fruitarian is the highest level that you should achieve here. And that way you have the physical energy and chemistry there, and your consciousness can wax and wane a little bit. Because you get too high, you can't function anymore in the physical world. And I tried to bring balance to functionability. I've always said this to a lot of monks. Yeah, you can sit there in meditating your navel, you can sit there and have out-of-body experiences, but put you in the middle of New York City, can you still remain in the now? And see, I've been practicing that, trying to run my practice, but remain in the now. When you come in to see me, I'm trying to remain in the now. I'm trying to look at you, see your aura, see where your body's having problems, and see you without hearing you that so much. I'm trying to keep myself in the now, because it's rough with all the things I've written, all the classes I've done, all the herbal formulas I've made and worked with. You got to be in the now as much as possible. You can't keep pulling yourself out of that. So it's developing the ability to be conscious, but at the same time run your mind, run your emotions, run your bodies, like driving a car. You're the driver, you're the watcher, and let your car follow you. Let your mind follow you. Let your emotions follow you. And for you spiritual people, that's practicing be here now, practicing observation. But at the same time, you lose thought, you lose memory, you lose the causal part of the mind, you have a hard time navigating. You lose your points of identification completely. You need somebody to move you to the bathroom. You need somebody to move you in places. And they're like, no. I'm not having anybody to move me. I'm going to move myself. So being in that higher levels and still running the bodies is where it's at, in my opinion. And it's where I keep working with anyway. It's crazy, baby. This is the last one for today. The last one in my folder. Debbie, I'm out of them. And this is Emmanuel, United States, 66. Man, I got all the middle-aged people here. And it is middle-aged when you think about it, because you really, 120, 144, that should be your age limits. 120 at least, mentally. So you're half the age you should be. But when you're in this world, when you get acidic and all that, when the time you hit 66, you're feeling it. When I hit 70, I started feeling it a little bit. I go, what? Man, I don't let anything get me down. 5'9", 220 pounds. Yeah, man. Yeah, man. So you got to work on the adrenal glands and the thyroid. Get on a raw diet. That's what I'm saying when we talked about obesity and how to deal with that. is you want to really focus on health. I'm getting healthy. No thought of fat or thinness either. I'm working on health. What's the doorway through health? Well, you don't destroy your foods before you eat it, so a raw food diet is uno number one, whether it's salads or fruits. I mean, we can argue all those things, of course. Humans are frugivores, and these are facts. But still, you want a raw food diet. And I see all this talking, and I saw Robert Kennedy, and behind him, Dr. Oz, and I'm going, you fake. Dr. Oz knows what the diet should be. He's already been 100% raw himself. He put 12 people in the zoo, took them to a zoo and put them all on raw. He knows, but he's sitting there, like, really? What, you forget? You're a medical doctor, so maybe you forgot. You're letting Robert Kennedy get away with the high protein concepts? Nah. Myasthenia gravis, psoriasis, and AFib. Yeah, definitely got your thyroid and adrenal involvement. If you got AFib, you got thyroid, probably parathyroid as well. You're not utilizing calcium as well, and you got adrenals involved. So the thyroid matrix and the adrenal glands are always involved in atrial fibrillation. Right? And then what else is involved with that? It's going to be your lymphatic system. Because you're not firing from the SA node anymore in the right atrium, you're firing all over the place. Atrial fib, you're firing all over the place in the atrium. And so you want to build health. I would get on the heart formula, no question, but then I'm going after my kidneys. You got psoriasis, that's telling me you're backed up, myasthenia gravis, all of that. Your kidney thyroid matrix. And so you really want to get your kidneys filtering. You want to go after your lymphatic system. Go after your gut. Look at Getting Healthy on our website, handcrafted.health. Look at the Getting Healthy and, look at our detox kits and get on them if you can afford them. They're not bad. I would also think about the side kits if you deal with parasites. Just get yourself parasitically cleaned out a little bit. Doctor, I'm an MD from Mexico. Yeah, baby. Cool beans, man. Love you. Living for a long time in the United States. In the last 3 years, I have been suffering from myasthenia gravis, making my life miserable because I can hardly speak or eat. Now, I'm going to tell you. Again, you're dealing in the autonomic nervous system, you're dealing in the adrenal glands, you're dealing in the thyroid, and my guess, my dear one, you're dealing in parathyroid issues as well. With the psoriasis, you're dealing in heavy lymphatic stagnation. Psoriasis, all these sort of things, not saying diseases, but all these sort of things, very curable. We've never had a case of psoriasis, head to toe. And that wasn't curable. And that is because you understand your lymphatic system, you get your kidneys filtering, you'll get that psoriasis taken care of, the gravis is taken care of as well, but that's your adrenal and kidney matrix. You want to get that moving, clean up the GI tract. I can hardly speak or eat. I don't want to go on the route of immunosuppressive drugs. Hell no. What are you suppressing? See, and when you're talking about immunosuppressive, you're suppressing what system? Because what system is your immune system? Oh, your lymphatic system. Your immune system isn't your blood. Your immune system is your lymphatic system. Look at where most of the immune cells are. Your lymphocytes, monocytes, neutrophils. These are in your, you've got them a little bit in the blood, but they're heavy into your lymphatic system. You got a sewer system with your lymph nodes and macrophages and that whole 9 yards. We're talking about bacterium. And it's simply put, my dear one, you're not filtering well. You've got to make sure, pee in a jar, make sure you're filtering here, guy. That's number one. Yeah. You want to see sediment in your urine. You're not being affected. That's your sewer system coming out. That's your metals coming out. They're either going to come out your skin or out your kidneys, or you're going to see them ooze from under all kinds of places. As a medical doctor, you've seen that probably under women's breasts, under the arms, groin, between the toes. Yeah, when you're backed up that bad, absolutely. So you want to open yourself up. Easy to cure. You need any help, I'm here for you. If you want to get a little deeper, give me a picture of your eyes. If you have brown eyes, get that light going across that iris so I can see more like this. See how easy it is? I can see these craters, I call them. Well, that's more the reality. Yeah, and you don't want that, my friend. The cholesterol is what you don't want. But all those are easy to fix. All those. The AFib, again, we're going to go into your thyroid, parathyroids. I don't know about your pituitary, but you got to also lose that weight. And that's also going to be part of that matrix. I just see the connection there of your adrenals. And that's, again, sugar metabolism, that sort of thing. Your thyroid is rate of oxidation metabolism. All these things are always involved in weight problems. Also edemic, you got to worry about being edemic, because if you have psoriasis, it's very suggestive you have heavy lymphatic problems. That's going to make you carry about maybe 20 pounds of water. And that's, of course, when we get in pulmonary edema, we get into congestive heart and that sort of thing. And it's like, no. And you can have swelling in the right atrium. You know, all that. So that's why you start working on that. You can use the heart formula as a treatment-based thinking, maybe, but at the same time, you want to get movement on that lymphatic system. And that'll pull all that heart clean. It'll enhance the parathyroid, which is calcium utilization, which is a nerve transmitter. All this stuff starts running, and your metabolism will go up. You have the adrenal glands, your metabolisms will go up, and then everything will come off nice. So at least you want to go on fruits in the morning. If you're from Mexico, you got to like fruits. So fruits in the morning, your salad at lunch if you want to go that way, and a fruit at night. If you want to have a real fun ride, man, you go all fruit. But stay away from the acid fruit initially, everybody. I keep forgetting to tell you that. So one lady came in the other day, and she's full of pain. She said, I'm all on fruits. And I said, what fruits? Oh, pineapple, all the acid fruits. And I go, oh. She said, I know. So we're here for you, man. You should fix yourself, and then show other medical doctors how you fix yourselves, because it's not difficult. That's not difficult to fix these things. Mm-hmm. All right. Love you guys. And thanks a lot for all your watching our videos and stuff like that. Remember, great antacid in the body. Have fun with that one. I'm excited to get home and get it steaming. But we'll see you. Have a fun weekend. Go after your problems. Remember, you're not your body, so don't let your body pull yourself down too low. All right? You're all beautiful beings. You're just trapped in this world where it doesn't understand health or anything like that. And so don't feel bad about it. That's why we're here. Education, awareness, that sort of thing. And so work it. Work it, and you'll feel better. Ups and downs always in detox and hydration. In hydration, you're going to see agglomulation be removed. And that's only in the form of mucus of all flavors and colors. And then everybody's good. And you'll feel better and better. But be careful with some of these surgeries, especially removing your whole colon, because you can get serious. You're not going to be a happy camper. And your life is totally forever changed. And not when you can spend a few time to work on this the right way, get that bleeding out of there, get those acids out of those interstitial spaces in the gut wall, and go on that way. And you'll find a relief you can't believe. Yeah, love you guys. Have a good weekend.